Go ahead.
My name is Sarah Dole. I'm an LPN at the Brattleboro Retreat, and I am going to be speaking on the new preceptorship program to take the place of the current orientation process at the Brattleboro Retreat, which contributes to poor employee retention. It also contributes to a decreased patient safety and satisfaction. The novice nurse, with their lack of experience, also contributes to this loss of company culture and contributes to the loss of revenue due to high nursing turnover rates. The agenda is to talk about a few ramifications of the current orientation process poses, the preceptorship training program itself, the personnel, implementation of the process, the budget, and then we'll conclude in the end. Poor job satisfaction is definitely a contributor to poor employee retention. In an article published by the American Nurse Today, they stated that when new nurses start a position without extensive introduction and implementation to their hospital, some issues can arise that create poor job satisfaction. They experience feelings of burnout when they don't feel confident to care for their patients safely, and their workload is combined with this inability to ensure patient safety. They also report dissatisfying relationships with their peers and managers. Medication errors are definitely prevalent with new nursing grads due to their lack of experience, knowledge, and oversight from more knowledgeable staff. According to the British Medical Journal, medication errors are the third leading cause of death, just after heart disease and cancer. That's an estimated 250,000 Americans each year. And the Joint Commission reported that 60% of all medication errors have been a result of poor communication. The new grad nurse learns so much through their practical application on the job in those first 2 years, which makes this guidance and oversight in the beginning stages all that much more important. The practice of implementing precautionary safety guards even becomes an ethical issue. The high nursing turnover rates, which are seen in new nursing grads, are an area of concern as well. According to nursingworld.org, nursing turnover rates are varied from hospital to hospital, but due to a study in 2016, the ranges vary between $22,000 to $81,000 per nurse. Also, the turnover costs are estimated to range between 0.75 and 2 times the salary of the departing nurse. Some contributing factors to these costs are advertising for new nursing staff, recruiting that nursing staff, paying for agency staffing or traveling nurses, paying overtime, which is time and a half, or even mandate pay, which is 2.5 times the hourly rate, to cover staffing requirements. This also leads to loss of productivity, contributes to a poor work environment, and there's a loss of organizational knowledge. The preceptorship training program itself is a 3-day program in which existing nursing staff at the retreat will be recruited based upon their merit and also interest in becoming a preceptor. They will go to a 3-day seminar. This is really imperative. It's been shown that integrating a preceptorship program to any hospital needs to include this training of existing staff interested in the role. So within this 3-day seminar program, they will focus on content knowledge. They'll do some role play to allow for practice, to allow for collaboration of ideas, and also in the end, they'll each do a short presentation on role modeling and professionalism. The personnel involved include CDO, the unit managers, the project director, the charge nurse and floor nurses, and the new hire nurses. So the new hire nurses will be under the direct guidance of their preceptor. Their preceptor will be under the direct guidance of the unit manager, and then the unit manager communicates with the CEO throughout the process. They all are required to have an understanding of the dynamics of the process, to go through an info session in the beginning, and then the new nurses themselves will be responsible for demonstrating a knowledge of their role within the preceptorship process. They'll operate within their scope of practice, and they will be responsible for collaborating with physicians, nurses, and unit managers regarding patient records and care. The preceptorship itself will start with an info session, and then continues on to this 18-week program in which the new nursing student, new nursing grad, is under the direct guidance and oversight of their preceptor. They have communication throughout the process with their unit manager, especially in the beginning stages. This budget was done to go by one individual nurse so that it can be applied with dependent upon how many nurses the retreat chooses to hire and then have go through this preceptorship program. So the 3-day training seminar for the new nurse, for the preceptorship, for the preceptor at $30 an hour is $672, and the clinical ed instructor who will be guiding the 3-day seminar for the training program at $40 an hour would be $960. There's an estimated $75 for myriad teaching materials, and the 18-week-long preceptorship salary at $23.45 an hour, which is the current starting rate for a new RN at the Brattleboro Retreat, is estimated to be $16,884. And so for this this snapshot alone, the total would be $18,591. So to conclude, and just to remind that an implementation of a preceptorship program to any hospital for the first time is a lot of work. It can be very daunting, and it takes a lot of coordination and feedback from all the staff involved. And this will definitely be a collaborative effort. We understand that change can be difficult, and we'll be here to be available for support throughout the whole process to ensure a smooth transition. We're looking forward to working with everyone at the Brattleboro Retreat to seeing positive changes that we predict as a result of this preceptorship program. And just a few of the things we expect to see are happier nurses, increased revenue, increased productivity, more qualified clinical staff, less medication errors, and which equals to helping more lives. Thank you.